Hi, my name is Madeline. Today we'll be doing a physical exam on a stuffed cheetah. And so for this exam, we're going to start off towards the front, starting with the eyes. We're going to make sure that these look pretty normal. You're going to see the whites of those eyes. You're not going to see any random shaped pupils. You're going to make sure they're the same size. Make sure that everything looks normal, no abnormalities. And then you're going to move towards these ears, making sure that you're not seeing any dark discharge going on in the ear canals, making sure that those look nice and clean, free of extra wax or debris. Check each side, and then you're going to move from there, go down towards the lymph nodes, check those out, make sure that they're about the same size, not inflamed or anything. Moving on to that neck, making sure that the thyroid feels all good, and then below that area of the neck you would feel more lymph nodes. For him it's a little hard to see, but they'd be about there, and they should feel ideally the same size. And then from there you would be moving on to kind of just the musculoskeletal system, making sure there's not any obvious pain going on in the spine. You'd work your way down, going all the way down to the base of the tail, and from there you can kind of take a feel around the whole body, really just making sure not to feel any lumps or bumps. Same with those front limbs, they'd be down like that. Making sure you're not feeling any weird lumps or bumps, making sure everything feels normal. You could even check out the paw pads while you're down there, making sure nails look good. No obvious signs of like discomfort or anything like that. Moving back towards that chest, the sides of the rib cages here, and just making sure that you're not feeling anything weird going on. You can even palpate the abdominal muscles here as well, starting just under that rib cage, really just pressing around, making sure that you're not feeling any abnormalities. Pulses feel good, auscultation is good, and then moving further down towards the rest of the abdomen there, down towards the pelvis, really just palpating everything, making sure everything feels normal. And then while you're over at the back end there, you can start feeling those legs as well. You would be feeling for some more lymph nodes sitting back behind the knee here, feeling those, making sure that those are normal as well. And then while you're back there, you can check out the genital urinary area, making sure that the anal glands look good. If you're doing your anal gland exam or anything like that, you can also take a temperature, rectal temperature, in which you'd insert a thermometer, wait a little bit. And for the cheetah here, that should read about 101 degrees Fahrenheit. And then from there, you can move back up towards the abdominal area, back towards that chest cavity. If you're going to start listening for heart rate or respiratory rate, for him you would listen for the respiratory rate, palpate if you want to at the same time. For him, his pulse is going to be strong. He's also going to have a heart rate of 120 beats per minute. For a cheetah, that's pretty average. And then while we're in that area, start for the lungs, take a listen for that. And for him, he's going to have a resting respiratory rate of 60 breaths per minute. And then yeah, so everything feels good on exam. He is rather large, so as far as a body condition score, he's going to be on the higher end. For him, I place him at a 9 out of 9, just since typically for a cheetah you're gonna see pretty lean figure. You want to be able to feel those ribs. Even for a cheetah, you might even see them just barely, but not like obviously or anything like that. But he is obviously rotund, so he would need to lose some weight to be a healthy cheetah. But thank you.